Campos is a 24-year-old male. His job is a communications equipment repair specialist for the military. He's an avid runner and was training to run in the Boston Marathon with his wife. He was deployed 3 months ago, and he recently found out that his wife is pregnant with twins. However, he was hit by a mortar attack and lost most of his left leg. But he did have a carbon fiber prosthetic leg designed for him, and he eventually wants to return to his job and fulfilling his dream of running a marathon. Our overall goal is for Jorge Campos to adjust to his new leg without any difficulties. What to expect? There will be some pain as what's left of his leg heals. He will have difficulty relearning how to walk. He will take time to get used to using a prosthetic leg. He will most likely end up falling a lot, and there will be some discomfort as he has to familiarize himself with the new leg.
The next 6 months, Jorge will need to meet with a physical therapist and occupational therapist. Jorge will go through physical therapy sessions once every week for about 2 to 3 hours. Towards the 5th and 6th month, Jorge will need to attend sessions every other week unless complications arise. Typical physical therapy session: sitting up and down a chair, moving the chair to bed, and balancing while standing. Basic stretching exercises such as rotating your foot, pointing your toes, bending your knees, etc. Walking in a ramp to reorientate the patient's center of gravity. More strenuous stretching exercises to test the patient's mobility. Physical therapists help patients to regain movement and manage pain. Teaches patients to different exercises intended to strengthen or stretch muscles or to relieve pain. They also consult the patient to develop an appropriate rehabilitation plan. Physical therapy aides work behind the scenes on projects and coordinate the things in the physical therapy office in order to run it smoothly.
Okay, so next is occupational therapy. A major barrier of a prosthetic leg is the feeling of dependence and incompetence. An occupational therapist helps the patient feel that they're independent and self-fulfilled through basic exercises. Sessions are simply talking with the patient or performing basic activities. Jorge can regain his self-confidence with his new leg while feeling independent, and each session should last approximately 30 to 60 minutes, and he would have one each week. So next, or finally, is in-depth occupational therapy. The first step is focusing on exercise needed specifically for the patient. In Jorge's case, he would have to focus on strenuous activities since he is wanting to go back to the military. Exercises such as running, jogging, stretches, or just getting familiar with his new leg. The second step would be to focus on activities that help with his daily life. After completing his goal, Jorge would need to continue with his normal life. Exercises to help do chores around the house, such as cleaning. Pardon me. Final step, gaining enough physical and mental strength to continue life. After finishing his therapy, Jorge would have enough confidence to complete his activities, ranging from a normal house life to vacations comfortably. Thank you. And this is our works cited, as you can see here. Hello. And then this is for Ava.